Dr. Rahul Chaudhary, who's going to be talking to us about digital and AI tools in the laboratory to diagnose cancer. So welcome, Dr. Chaudhary.
Good morning, good afternoon, and good evening, everyone, wherever you are attending this summit. I'm very happy to come in this summit and present the digital and AI use in the clinical labs and how that actually influences the healthcare ecosystem broadly. So I'm Dr. Rahul Chaudhary. I'm based in UK, and I'm the Group Director for Pathology at Unilabs. Now, for people who don't know Unilabs, we are a multi-country, multi-lab organization doing a number of lab testing. So for people in Europe, you very well recognize this name. For attendees in the US, LabCorp or Quest might come to mind. That's the kind of work we do. In terms of the agenda for today, I would like to actually place this into context into three parts. I'm conscious of time, so I will keep it short. Let's start with context of digital transformation and AI in healthcare broadly, and then provide some example use cases specifically in lab diagnostics, and then talk around subspecialties of pathology and radiology. And then finally, how use of those lab cases, how that influences and transforms the wider ecosystem where we operate, and in generally labs like us operate, right? So as I said, there are multiple ways of diagnosing a patient, and there are various techniques to do so. Now, I would like to actually place why digital and AI in healthcare today, right? We all know that healthcare is actually late to the digital party. It's been a very conservative exercise in the healthcare area to start digitizing. Obviously, COVID played its role, which has actually accelerated the uptake of all of the digital and AI tools across the healthcare ecosystem. And if you see the graph on the right, you can actually see post-COVID what has been the uptake speed for various industries, and healthcare tops it. So it's a live example of how a crisis can be actually an opportunity for expansion and innovation. In terms of healthcare ecosystem, the needs for digital and AI are enormous, and they provide examples and solutions across various needs, such as connectivity, where we need patient access, equity, inclusion, and that's a big topic today in healthcare. We talk of efficiency and productivity as well. And then quality is an important one, where we need to have it first time right so that the patients can be treated properly at the right time and with the right treatment. And then obviously savings is a big component of all of that, because the reimbursement agencies, the insurance agencies, they want to see efficiencies in payments. So from that perspective, if the downstream labs, if the healthcare organizations can actually provide these efficiencies and productivity using digital and AI, that positively affects the ecosystem. Now, digital transformation is actually a feedback loop. What I mean by that is, when you see the healthcare ecosystem, it's composed of various organizations, various sectors, right? You can have the health and social care sectors, where you have the healthcare providers and the professionals. You have the professional companies, you have the policymakers, the government, you have the universities and research, and then obviously the insurance and investors from the funding side, and the third sector from charities and associations. Now, all of these are stakeholders in the ecosystem. And when you see what data elements they would use within that ecosystem, there are many: contextual data, clinical data, patient-generated data, and then data required from the policy perspective and planning perspective. Now, all of that data is put into an analytics engine overall in various sectors. Knowledge is created, and then it's used further to promote innovation and use of that to enhance healthcare. Now, digital transformation is a very specific exercise. It's not a one-size-fits-all, and it's actually very well depicted in this diagram, where it's the first part of the journey is actually digitization. So converting everything from analog to digital, so from bricks to bits. The second part of the journey is using that digitization into the operational efficiencies. So you automate the processes and you then streamline them, right? So that actually transforms the institutional operations. And once you have transformed that, you then go further across the whole organization and the ecosystem towards digital transformation, where you actually take a series of coordinated steps that affects the culture of how people work and view healthcare, how the workforce interacts with these tools, how the technology actually then shifts the entire operating models across the sector and then influences the operations of various institutions. And then that transforms it back to the healthcare ecosystem. If I go to the next slide. So digital and AI adoption we see is actually on the rise. If you see the diagram on the left, you have this global digital health market in billions, and you can see the maximum funding is taking place in the care delivery models. And then from the industry that I come in, screening and diagnostics, as well as wellness and disease prevention, that's also taking up a huge chunk of the market size today, right? And if you see the AI applications currently in this digital healthcare ecosystem, they're actually on the rise. I'm not going to go into the details of each of these, but what you have on the x-axis are actually various functions that use those systems. And on the y-axis, what you have is the various implementation of the AI technologies and how that affects. What is interesting to note here is diagnostics is playing a big role in increasing the AI adoption into the general healthcare system. Now, what is actually the context of all this with respect to diagnosing a patient or diagnosing a disease, right? I talk of this impossible equation today, which needs solving, right? The impossible equation is that if you see today, there is decreasing staff in terms of specialization. There is pressure on the insurers to reduce the insured amounts because the number of tests are increasing, the volumes are increasing, they cannot cope up. The testing volumes are increasing at the same time. The budgets for the countries are decreasing. And then if you see the need for diagnostic accuracy is increasing. The need for standardization is increasing. The costs are increasing. And then if you see the volumes of the samples are increasing as well because of the population size and more chronic diseases because you have more people living longer. So this is the impossible equation, and there is a sweet spot here in the middle. And that sweet spot can be enhanced through the use of digital, AI, and automations. I'll go specifically now into a specific aspect of lab diagnostics, which is pathology. It's a very labor-intensive. Now, this is an example that I want to give from a perspective of digitization, AI, and how that actually affects the ecosystem downstream. Right? So traditionally, pathology has been a handicraft system. Basically, there's a lot of manual steps in the process, and you need expertise, trained eyes, and hands to get the results right. And what you have here is the whole workflow of when the patient enters into the hospital chain through admissions, they go to the care units, they undergo the biopsies are then sent to the labs. Various processes are done on it, manual and digital, and then finally the results are generated, which go back to the patient. So from that perspective, imagine if you would have automation and digital across these various silos and how that would actually help reducing the inefficiencies in the manual workflows and allow standardization of sample outputs every time, right? And as well as when you digitize, you get use of AI, data analytics, and all the segmentation tools to go with it, which has further applications. Obviously, what that does is the quality and speed of processing increases dramatically, and that actually positively impacts the treatment times and how the patient is treated. So when we talk of digital and AI, we always like to look at integration of these various tools together and working hand in hand. So interoperability and integration are big topics today in healthcare. And I'm not going to go, what the diagram on the left-hand side suggests is the top part is where there's an analog process. And when you want to digitize it, it becomes a more smoother process. What that diagram that shows you here is the complexity of digitizing a single lab modality. It's a complex process in itself. It's a multi-year process in a single lab. And if you extrapolate it then to the healthcare systems, we understand the complexity of actually the digital transformation in the lab diagnostic space. Because on the right-hand side, what you see are the data models that actually look after the transformation actually happens, right? So that's, again, the whole journey. I'm not going to go into that, but suffice to say that it turns a manual process into a paperless lab, and then you have electronic health record connectivity across the ecosystem, which in itself is a complex exercise. Now, the speaker before me, Julia, was talking about oncology and cancer, which is, again, a huge area of lab diagnostics. So if I actually look at a typical patient journey in cancer, there are various touch points for that patient across the whole journey, whether it's actually doing some preventive medicine tests, whether it's screening the patients for various disorders, whether it's diagnosing the patient or staging them, treatment, response, and follow-up, right? And at each step, there are various touch points that healthcare systems can come on to with the patient, interact with, and then provide the solutions. And then to have that digital enablement in the ecosystem and how that actually connects the various organizations. You have the patient, the hospitals, the pharmacies, the doctors, the providers, right? All of the data that goes into the cloud. Now, companies like us from the diagnostic lab perspective who provide all the results, they go to the physicians interact with that data, provide the results back. All of that goes back to the cloud again. The insurers interact with all of that data. So you see how that digital data flows through the ecosystem. And if any one of those processes are manual, there are difficulties for enhancing productivity and efficiencies across this. Now, from a computational diagnostic perspective, what if you would have digital? You can actually start to do various interesting things in terms of diagnosis, right? You can put in various treatment pathways and patient management tools of integrated medicine. When I say integrated medicine, you use various modalities of diagnosis, whether it's molecular, pathological, radiological, and other liquid biopsy results, for example, right? All of them can be combined into a fused data model. Algorithms can be developed to query that data, and then results can be given back to the patients, right? And then you apply various AI tools across that system. What is interesting to note here, what are the processes actually required to do all of this? You have issues around data ownership, data collection, storage, and reporting. So all of that requires robust ecosystem partnership models, because there are various players in this whole ecosystem who, within this supply chain of data management, flow the data around. And then healthcare system will also need new sets of capabilities, new trainings, new business models to be actually able to use these modalities and capabilities. Now, from an actual example perspective, I want to talk about the digital transformation that we did at Unilabs. Pathology, traditionally a microscope exercise, was converted into a complete digital scanner-based diagnostics. And then radiology, which was traditionally done on films, went back to computational radiology as well. And what that did for us is you can actually see the statistics of reduction in turnaround times for these samples for both pathology and radiology, dramatic turnarounds. And that actually are live examples from some countries. And that positively affected how the patients got treated. It then went downstream into how the healthcare organizations looked at these efficiencies. They spoke to us and they did some of the changes themselves. And then the whole wider ecosystem was positively affected because of this. That led to increased productivity, more efficient processes, and more specialization. From a medical quality perspective, you have more accuracy as well. So with digital, you can actually send samples to specific specialists. Without that, it's a big logistic exercise. And when you have specialists looking at these samples, there's obviously better quality and better first time right results. Again, once you build this digital platform, it becomes scalable. You can have subspecialized workflows where I said you can match specialists with their competencies. That improves the reporting quality and efficiency, and that improves the patient outcomes. You can actually incorporate AI solutions to aid the decision-making of these doctors, also improve workflows inside the lab. And then you have these flexible working environments for doctors who can report remotely and work according to their work hours, right? So more flexibility in terms of reporting. What you also see is with increasing efficiency and increase in quality, you actually have higher quality with lower costs. So that affects the ecosystem again in a positive way. And we have live examples of doing that in Europe. Now, from a scaling perspective, how do you actually scale this whole thing, right? So we have what we call as a digital lighthouse model, where we actually do these innovations in specific lighthouse countries, and then we percolate these models across to different other countries. So you can see the arrows here where specific specialties were perfected in one country, and then these solutions and best practices were exported to other countries as well. And that has actually led to sharing of best practices across these countries, improving efficiency, productivity, and all of the modeling of unique technologies, right? Which has led us to be one of the best lab groups from a digitization, automation, and centralization perspective.